Hello and welcome to Community Matters, a podcast from the Canadian Association of Community Health Centres. I'm your host, Hilary LeBlanc. This year, we are celebrating 100 years of community health centers, which is so exciting. And the eldest who we've already interviewed is Mount Carmel Clinic in Manitoba. So if you haven't watched that episode, I encourage you to go and check that out after this one. We wanted to continue to speak to the oldest community health centers in their respective provinces and to hear about their work, legacies, and their growth as they continue to impact communities. We are joined by Michele Hurtubise from Centretown Community Health Centre in Ottawa, Ontario, who are 57 years old this year and the oldest community health centre in Ontario, as well as Lisa Clatney, the executive director at Saskatoon Community Clinic in Saskatoon, Saskatchewan, which is the oldest community health centre in Saskatchewan and turning 64 this July. I also wanted to shout out some of the older community health centres in other provinces. The Alex in Calgary is the oldest in Alberta at 53 years old, and Reach and Island Sexual Health Community Health Centres are both 57 years old this year, making them the oldest in British Columbia. So many older CHCs. How are you both doing today?
Great. Happy to be here. Yeah, and happy to be 57. It's like the 50s are where it's at.
Right?
They really are. I tried to do as much research as I could in terms of the age of the CHCs. And as I explained, some of them it's organization age versus actual community health center age. But everyone looks really good for their age. And a lot of them are around the same time, which I find really interesting in terms of like healthcare shifting and what was going on in the climate about 60 years ago to have so many start to trickle in. But we will get to that. I mentioned before we started recording, but I've had the pleasure of chatting with both of you before about your community health center. So it's nice to chat with familiar faces. That also means that there are episodes about your community health center. So anyone watching could also learn more about Centretown and about Saskatoon Community Clinic if they wanted to go check those out. But Michele, I'll start with you. If you wanted to give a brief synopsis, if anyone doesn't know about the amazing work that Centretown is doing, the community that you serve, and the programs that you offer, what is Centretown all about over in Ottawa?
Well, thanks so much. Yeah, as I was, refreshing myself on the history, and we will talk about this later. There are some interesting things about how we started and the work that we're currently doing now as well. So here, Centretown Community Health Center is a downtown community health center. So for a very urban setting for people who may be familiar with Ottawa, we're at Cooper and Bank Street. So literally just a few blocks away from the Parliament buildings. We offer a wide range of services, including our, primary care, community development, health promotion, community kitchens, diabetes program, mental health, substance use counseling, a wonderful program focused actually on seniors 55 years in age of older who are working with substance use or other process addictions. And our most recent launch of programs and services is a 24/7 mental health and substance use crisis response for non-police response with peers who have lived and living experience of mental health and substance use. And in terms of our priority populations that we serve individuals who have mental health and substance use, obviously given what I have said, but also families with young children with our early years program, seniors, and newcomers and refugees. And so a broad range of services for all of those programs. We also are one of the very much an anchor agency around trans health specialized services and queer counseling and programming at our community health center. So a busy hopping place.
I've had the pleasure to go. I still have to get over to Saskatchewan ever to visit Saskatoon, but I will say that I had a wonderful time at Centretown. And it is a hustling, bustling, like it is right downtown, and an amazing space. And now, Lisa, tell us about Saskatoon Community Clinic and why I need to get down there, and why I should go visit and see the amazing work that you're doing over there.
Hilary, you need to come this summer. Let me just start the conversation by that. Summers are beautiful in Saskatoon. That's the time that you should come. So the Saskatoon Community Clinic is a long-standing example of team-based, people-centered primary health care in Canada. We have a large multidisciplinary team, including physicians, nurse practitioners, and almost every allied health professional you could think of. So occupational therapists, PTs, dietitian, mental health. We have a fully functioning lab, pharmacy, etc. etc. It really is that one-stop shop for our patients and clients who attend our services and our buildings. We serve about close to 20,000 patients across 2 primary sites in Saskatoon. And as a CHC and as a cooperative, our organization, of course, is very responsive to the needs of the community. So as the needs in the community has changed over the past 64 years, so too has our programming. But I would say some of the key programs that we currently offer would include a focus on senior health, substance use. We have a strong HIV care component at our Westside Clinic. Gender affirming care, we were kind of front and center when that work began in our province. Reproductive and women's health, coping with chronic conditions. And then we also have a strong refugee health program that we operate in collaboration with other agencies and institutions across the city. And so we see every refugee that comes to Saskatoon and they get care for the first few years at the Saskatoon Community Clinic.
Wow, impressive. Adding it to my summer list, also to stop by and visit.
Yes.
And I am curious, Lisa, because you did sort of perfectly segue into, I'll say for both of you, I know that neither of you were at your CHCs 57 and 64 years ago, but I am curious, Lisa, if you can share, I guess, a bit of how that mandate has changed or what the programs looked like when Saskatoon first opened its doors to where you are today.
Mm-hmm. We have a very unique history, actually, that's relevant to kind of the birth of Medicare and how that all came to be in Canada. So the community clinic in Saskatoon and other healthcare cooperatives across the province really did play a pivotal and historical role in the development of Medicare in Canada that of course happened in the early 1960s. So when the medical care insurance plan was introduced, it created a deep divide kind of in our province, and there was many physicians that were opposed to that insurance plan. They were fearful of their loss of autonomy, not quite sure what that was going to mean for them. And so on July 1st of 1962, of course, the medical care insurance plan officially came into being and a doctor's strike ensued. And there was a small group of committed doctors and community members that really felt strongly that healthcare needed to be publicly accessible and available to all citizens. And so we literally started the community clinic following the doctor's strike. And I think we were operating out of one room, with one nurse, 2 doctors, 1 telephone. But it was pretty historical in terms of how that all came to be. And so it's a really unique history. And we definitely came from humble beginnings, I would say, but quite amazed at how much we have grown. And I would say definitely in the early days, we functioned more as kind of a traditional, primary healthcare center with just the physician and the patient. But we began actually adding allied health professionals early on, which was quite innovative for a clinic in Saskatoon.
Wow, that's fascinating. Maybe that's the answer to my question at the start about how everyone sort of cropped up around the same time. Maybe this is the research I needed to know about, because it's very interesting. And Michele, what about Centretown and its opening 57 years ago? What did it look like back then?
Well, I think what's interesting is that we grew out of some issues and concerns that they were seeing at the YMCA here in Ottawa. And interestingly enough, was around transient and unhoused and youth who were struggling and who were coming into conflict, both with the law and with individuals and providers. And it was drug emergency services for youth in crisis. And it was clinicians and youth workers who were really concerned about what they were seeing. There was support around birth control, reproductive health, and again, focusing heavily on youth. So when I think about where we are now, and then circling around to our 24/7 peer outreach, which is not necessarily focused on youth, but is also working around substance use now, it feels very, very relevant. And then we grew from that, but always having a mix around the clinical and the community supports working together. And I think that is really one of the hallmarks of most of the community health centers that I talk to around the province, around the country, really, and some of their interdisciplinary teams is that mix, that it's not just clinical provision and it's not just what's happening about people walking in our doors. And for us in Ottawa in particular, which has 6 community health centers, and we followed fairly quickly after one of each other. We're all within sort of 10 years or so of each other starting up. Many of them started as community resource centers, grew out of community need, grew out of the lack of access around primary care, starting the organization. I do think of Medicare coming forward, but also of the real need to have services based in community and by and for community, and that real principle that if we're designing services for not only the community programs that we're serving, but that link between health and where we live is so fundamental and so connected, I think, to the ideology of what we stand for as community health centers.
Thank you. That very, very, very well said. And I mean, you did already touch on it, but I am curious in a way how I guess I would say how your mandate has grown, because it sounds to me like it hasn't changed too much over time, since you have this full circle moment of still doing, drug and substance related services. So Michele, how has Centretown, I guess, evolved?
Well, I think one of the really interesting pieces for me has been, not only have we grown around our clinical services, primary care, community programs, but at one point we also had a legal aid clinic and pardon services with us that moved along. A few years into our growth, we have added more regional programs. So moving from where I said, we grew from the very neighborhood, but then, some of the funding pieces that there are needs to be able to be working at a more regional level. And I think that as we've looked at some of the programs and services that have evolved, for example, our diabetes programs or our trans health program, is that those are services that are certainly not only needed in the local neighborhood levels, but have a broader scale and coordination across those services. And I think one of the other pieces where we have really grown has been, we were part of the founding Association of Ontario Health Centers. So you started this talking about each of the provinces. I think Ontario has maybe had the longest provincial association continuously to support its community health centers, and we have one of the largest numbers of funded community health centers, I think, in the country, where we are now at 74 community health centers, and that number has fluctuated as there have been some amalgamations and some transitions to other models. So those, I think, have been some of the biggest shifts and changes and growing. And certainly where we are located, here, it was always part of the population to serve the 2S LGBTQ plus community, but that has been a real focus. Although the queer village isn't as big in Ottawa as it is perhaps in Toronto, we are located in the queer village of Ottawa, and that has been a big focus of a number of our programs and services. So not just for the general population, but, for example, providing specialized supports for LGBTQ newcomers and refugees, many of whom have fled their homes because of persecution from being from the LGBTQ community. And I think that has also been one of the shifts of emphasis for us.
Thank you. I find it really interesting, sort of like what you were saying. I would consider Ontario the community health center hub, but a lot of them, like with you starting at 57, it's interesting because the second oldest of all of them is again in Manitoba, right after Mount Carmel Clinic is the SERC, the Sexual Education and Resource Center. So it's really interesting to see that the oldest started in the West, but the most are very central. And the nerd in me wants to know so much more. But anyway.
Well, and I think you referenced, if I could just jump in there for a second, I think there's lots actually also around sexual and reproductive health is a common theme in a number of the centers that started up. And not surprisingly, if you look at the birth of birth control that allowed reproductive health and freedom in the 70s, and why some of those clinics got started with that, and some of the work around then supporting in the 80s, HIV education and testing, and sort of some of those components that came along in those services, and thinking about priority populations in terms of we're designated fully bilingual and provide those services, so that for populations that then started facing barriers to accessing care as we became more established in Medicare for Canada, then it became a lot about access for populations that might face those barriers.
Yeah, 100%. Island sexual health. I believe they were created in 1969 as part of Planned Parenthood, and then only separated a couple years later. So very similar to what you're saying. It's out of these needs for these very specific populations, and like I said, very fascinating. Lisa, did you want to share how Saskatoon Community Clinic has evolved and shifted over time as well, from that possibly one room primary care to what it is today?
Yeah, I mean, can I just say ditto to what Michele said?
Yes.
Because I think it really is a similar story, right? And I think one of the things that community health centers are so great at is identifying needs in community, because we're so linked in and we understand where that need is. And then we try to respond and close the gap in community. And I think that's an amazing aspect of community health centers and what is a real strength of ours. So certainly I think from the Saskatoon community's perspective, our mandate also, really hasn't changed. Our vision has always been healthy people in a healthy community. But what we have seen is the needs of the community has definitely shifted and evolved over the past few decades. And where we've kind of grown are areas where there were priority populations, where we could see that there was members of the community that were really struggling to have equitable access. And that's a place that we really found ourselves responding to. In fact, our West Side Community Clinic, which is just, I think, about 50 years old now, was actually formed in response to realizing that in our core neighborhoods of Saskatoon, that people were struggling to access primary health care and the type of team-based care that we offer, and the type of team-based care that the community really needed. And so as a cooperative, again, we have such a strong foundation of our members being vocal and helping to guide what we do as a community health center. And so the West Side Community Clinic was actually formed in response to our members saying, hey, there's a need in this community, and we need to really focus on ensuring that everyone has access to primary health care. And that's kind of, what we've always done, is respond to that need.
Amazing. Thank you. And Lisa, you're both segueing perfectly into the next question. So this is making my job so easy. But I was about to ask why CHCs are such a crucial healthcare model. So Lisa, if you'd like to continue on their importance.
I think, yeah, it really is that being able to respond to community need and being nimble and just being really connected into the community and developing those strong relationships, creating a very safe, trauma-informed space for people to receive care. What I have seen a shift, and it's really great to see, is that there's more and more, I think, realization that healthcare is really taking care of the whole person. It's not just a focus on the disease or illness. And I think that's something that CHCs have had since their inception, but it's now just starting to become mainstream. I know in Saskatchewan as well, like the model of care that we had always ascribed to, which is that team-based care, was novel and innovative. And now the buzzwords around, patient medical home and team-based care are starting to be heard more and more in our province. And I just think it's so interesting, because we have been doing the patient medical home model, team-based care, since literally 1962. But it's great to see that the model of care is now expanding. And I still think as a CHC, then we're still kind of at the forefront in innovation. So we're at the community clinic actually moving beyond the patient medical home concept, which is really strengthening that relationship between the patient and their primary healthcare team and ensuring that all the services are kind of circled around that patient, to actually a patient medical home neighborhood, which in my mind is a much more robust model, and recognizing that partnerships in community are really key. As a Saskatoon Community Clinic, it's hard to realize that you can't be all things to everyone all the time. But again, I think an area that CHCs really excel at is our ability to forge really productive and positive working relationships with other community-based organizations or external agencies and community, and really as a group being able to wrap around our services and offer programs to the unique population that we serve. So that's kind of where I'm seeing CHCs really are still being able to excel in community, is being even moving beyond that patient medical home model into the next new thing.
And Michele, did you want to add anything?
Yeah, I think that, one of the pieces that Lisa's really speaking about that, we talk about all the time is that community health centers live and breed partnerships, that we know it's not just about us. And while I think that there are sometimes absolutely some areas where there are challenges in our funding, and I know this is sort of coming up within those pieces, but I think one of the real successes of community health centers, wherever I talk to them from across Canada, has been our depth and breadth of partnerships. We know how to partner. We know how to meet people where they're at. We work with all sizes of organizations. It's not just about us. It's about how can we leverage and build that community capacity, not just within our clients that we work with or within the neighborhoods that we work with, but within our partners, and how do we leverage and work with each other. And that's something I have to say, having worked in other sectors, I know they partner, but it has still never been to the depth that I experience in community health centers. There's something about the way that we were birthed, the way that we have these conversations, maybe the way that we had to come together around particular ways of funding, that we do things in part. There's very little, I think, that most of us do that isn't without another group of community partners. And even when we're applying for kind of funding, even if it is a go at your own kind of proposal, we're drawing in the community partners to make the best use of the strengths. And it's that neighborhood focus, and that partnership focus, not just the individual focus, that I think is so essential.
And if I can just add to that, I think another strength that allows us to really work in the space that we're in is actually how we pay our physicians. And I don't want to get into this whole ideological thing around like fee for service or alternate payment or being paid a salary. But I do think that most of our healthcare system is set up to incentivize and reward volume-based care, right? It incentivizes that quick kind of in and out, and the larger number of patients or clients that you can see through a day usually is more financially beneficial. And I think right from the outset, how we've been set up and having our salaries or having our physicians be paid a salary versus that fee for service model allows them, number one, to kind of embrace the team that's around them. But secondly, if they need to take a little bit extra time with a patient or a client, they can, because they know that their bottom line or their financial well-being is not going to be impacted by that. And I think that's so huge. And certainly from the community health center perspective, I mean, we just completed a study this past year that showed absolutely our patients compared to those outside of our CHC, our patients are much more medically complex. They have much more social determinants of health. And I think that in itself, the population that we're caring for doesn't lend itself to that fee-for-service model, but it certainly lends itself to the model of care that we ascribe to at the clinic.
100%. That makes a lot of sense. Thank you. And I'm curious as well. So back to your CHCs and outside of the model, I'm curious about the successes that you've each had over the decades. Lisa, if you'd like to start and share some of the amazing work Saskatoon has done.
Yeah, I mean, I think the fact that we're still growing, and we have steadily kind of grown since 1962 is quite a success for us. One of the things that always strikes me as an example of how the community health center model really worked was during the pandemic. And I think we weren't unique in that when the pandemic hit, we quickly realized that our system was not set up to provide care to the more marginalized population. And so again, as to, Michele and my points around our ability to partner, we quickly worked with our community partners to mobilize and almost create our own system for how we were going to care for our most vulnerable population. And I think that's a success that we continue to see. Right now, we are in another crisis with substance use and so many people that are lacking food security and housing security. And I just see how our community health center is working with partners to try to develop a robust model where we're really meeting folks where they're at and just trying to provide the care that we can. And beyond that, I think, again, just the number of unique programs and services that we've offered that no one else is doing, but because we've seen the need and kind of want to close the gap in community. And I think that's a very special place of pride for SCC.
100%. And then Michele, what about Centretown's successes over the decades?
So I wouldn't be someone who identifies themselves as a community advocate without highlighting some of the real successes around advocacy. Centretown often prides itself as being sort of at the front and center of a number of advocacy issues. We have been a really prominent voice around a number of issues related to health and immigrants and newcomers. And in particular, I mean, today I've got staff right now, today on April 14th, when we're recording this, who are at Parliament Hill protesting the cuts to the interim federal health program and the implementation of copay and that the detrimental effect that has and will have on our community. But we were at we've been at the forefront of getting harm reduction gear into community based settings with a number of our community partners. We took a lead on advocating against having a casino in downtown Ottawa. And while that may seem kind of like, what are you going to do about that from a health perspective? And yes, we do have casinos in Ottawa, but they are the outskirts of our city, not right in the downtown. And that was really important from us from a process addiction that we have when we do work around that. We've coordinated in response, taking us back to the Romano Commission and talking about sort of some of those pieces. We came together and were funded as part of the first wave Ontario health teams in Ontario, working with the other 6 CHCs because of our data. The quality of the data that we have and being able to take a lead where most other communities were being led by a family physician. We had coordinated centralized intake for diabetes programs, which was the first, again, that it had happened in the province. But we planned, again, that was planned from the very beginning of our diabetes services is let's not have a bunch of diabetes teams. Let's have a centralized intake and pitch that proposal and had it funded. And then, as I said, now recently having a 24/7 mental health and substance use crisis that is peer-led and responding to mental health and substance use crisis with one of the most diverse groups of staff who are led by Black, Indigenous, and other racialized leaders, working with a very diverse group of staff to respond to those mental health and substance use crisis communities and really providing, as Lisa said, that trauma-informed lens so that, we are reducing the harm created in Black, Indigenous, and other racialized communities and reducing their interactions with police when, there's been so many incidents when somebody has been having a mental health crisis, somebody's called 911 and the outcome has not been good for individuals. So all of those kinds of programs and services, certainly our trans health program, like the list just kind of goes on. Like I could have a whole hour on just celebrating, as I know Lisa could, as any of my colleagues could, and that, that we have grown really from, that clinic in the YMYWCA to as big as we are now.
Amazing. And Michele, I'll ask you as well. the data can be an option, but I'm curious if there are other innovations that you would like to highlight that your CHC has come up with. I do remember the advocacy, I think, is definitely at the forefront of that for sure. But is there anything else you'd like to highlight?
Well, I think, I mean, there are any number of pieces. One, certainly, I will speak about, in Ontario, we are, I think, unique in Canada in that the community health centers have centralized data. We're all on the same electronic medical record, and we have a centralized business intelligence reporting tool that allows us to collect data and talk about the impact of all 73, 74 of us together. And that's really quite amazing. Has been enabled us to talk about the complexity of care of our clients. But some other pieces is that we have, been right there around trans health and increasing the community capacity of physicians and nurse practitioners in our community to provide services as part of integrated primary care programs in our community and services by partnering and mentoring those individuals who have been interested, who have taken the training from perhaps some other places, but really needed that support and mentorship. I'm also really proud of our physician team, who I think has had the first residency elective with a medical school in Canada, where they can take a month-long residency elective as part of their family medicine residency, and it's elective, and that has meant that we are building into the family residency education training on gender affirming care. And when you think about how many people have to go to specialized clinics and travel, that for me is among some of those pieces that are some of the most innovative work that we've done.
And then Lisa, any innovations that you'd like to share that you're doing at Saskatoon Community Clinic?
Yeah, well, Michele just actually tweaked for me that one of the things that we're really proud of is for decades now, out of our West Side Clinic, we've had what's known as the SWITCH program, so Student Wellness Towards Community Health Initiative. And through that program, we have secured so many bright new physicians, nurse practitioners, nurses, you name it, because they come to the program, they volunteer their time, they're exposed to the work in the community, and they fall in love with it. We're really proud of this initiative towards community health because it's been a great way to expose young learners, people that are just entering into the healthcare profession with the work that we do in community. And it's actually been an amazing recruitment source for us to find talent and retain it that way. So that's been great. The other innovation that is just kind of on the cusp, we've been working on it for several years now, but one that I think is really exciting is a partnership that we've established with the Saskatoon Tribal Council. So they work in the same space as we do. And we've recognized kind of over the past decade that we really do need to change how we're providing primary health care in Saskatoon's core neighborhood. The current model is just, it's not working. And so with us partnering with an Indigenous organization, we have this vision of creating this multi-agency collaborative that provides seamless care. So whatever door a client or relative comes in is going to be the right door, and we're going to be able to offer all of the services that they need to access. So focusing on health, but also social determinants of health, and in the spirit of an intent of the TRC calls to action. Because what we've recognized is in our core neighborhood, there's the highest disparity. So on all of the indicators and metrics that we're tracking, we know that the population that we serve there needs specialized attention. And there's systemic inequities, poor housing, and of course it is resulting in high system use, high merge department visits, high hospitalizations. And so very exciting. We just recently have acquired a building because one of the big things was we want to co-locate. We want to bring all of our partners in to truly first ascribe to the philosophy of care that we want. And so everyone has to really get on board with providing trauma-informed care, with creating safe, respectful places, but to co-locate and bring in all of the partners to meet the needs of community. And so one of the biggest things is how do you have a building that's big enough to house what we want to do. But we have recently acquired a building right in the area. So that's kind of like a first step for us, and very excited around that partnership and what it could mean to the community. So stay tuned. We're hoping to have more exciting news soon about that initiative.
Congratulations. That's so exciting.
Yeah, it is.
Yeah, and really I really appreciate the collaborative effort. So I am curious how you've respectively been able to navigate certain challenges that tend to just crop up by nature of the work that we do, whether it's funding or policy or workforce. And I'm curious if you want to share what some of those hurdles and challenges have been at your respective community health centers. Michele, if you'd like to start.
Yeah, I think so. I've been working in community health centers for close to 35 years myself, and there's been a lot of changes over that period of time, and I've worked in a number of different organizations in a number of different cities. I think adjusting to the policy changes is, one of the challenging parts of this. When community health centers in Ontario, for the longest time, and some of my early exposure and working within them, we were in a separate little funded branch, for example, in the Ministry of Health. So we weren't even considered primary care. And so even though we were delivering primary care, I think we were at maybe 2.5% of the population received their care from a community health center. I think we're now maybe up to about 5% of individuals who receive their care from a primary care. But in the 90s, or like in the late 90s, early 2000s, when we moved into LHINs, we moved into the primary care branch. We fought for that for a lot of pieces, but that has brought its own set of challenges, because the whole model of health and well-being, the whole model of community health centers that includes things like health promotion and community development and capacity building, is not included in that primary care. And in fact, we have very few indicators in our accountability and funding agreements that are related to this very critical piece of work that we are also doing, that is that broad-based community health component. And so, there are sometimes I have conversations with colleagues of, was this the right decision to fight to get into primary care? And at the same time, I don't think we would be seeing some of the success of funding of community health centers across the province of Ontario right now, with the expansion that we're seeing of interprofessional primary care teams, if we hadn't made that move into primary care and been seeing that. But that's one of those tensions. Another tension has been, there has been a number of different policies over the years related to how we respond to individuals who use substances and maybe having addictions or using illegal substances. And there's been, a number of components, including, some that have really dove deeply into evidence-based practice that have informed their policy and decision making, and others that have not leaned so much on evidence-based decision making. And here in Ontario, we're seeing, and not only in Ontario, but we are seeing the closure of community or supervised treatment services across Ontario and across Canada, which has a real impact on harm reduction. Again, we see some issues related to the attack on gender affirming care and various levels of support related to that. And so I think that there is a bit of a cycle that happens. And, I think one of the challenges is figuring out how to ride the waves while still keeping focused on your priorities, on your visions, on how you're going to support the communities that most at need. At one point in public policy, they said, well, community health centers are going to be the primary care model that focuses on those who face barriers to accessing care. And the Ottawa CHCs actually pushed back and said, no, we are good for everybody. We want to serve not just the priority populations, but the populations also that, have face barriers to accessing care. And it's interesting to me because I worked in a community health center that were proudly the last choice for people to come to, in that we served everybody who nobody else wanted to serve, and we're proudly in that category. where I am now at Centretown, we serve a mix of people general in the population. I have CEOs and ADMs. I receive my care at a community health center. And we also serve individuals who face, really significant barriers to accessing care. However, what I find fascinating about that, though, is that when I look at the complexity of care indicator between where I was before and where I am now, there's not that much difference, even though we serve a general population. And I think part of that has to do with even though that population is made exclusively of individuals who face barriers to care, and we have a mix, we're also serving some of the really a lot of our clients are really ill when we see them, and so the balancing out just happens in a different way. But that's been some of the changes that we have, gone over the past couple of years, and I will say right now that sometimes I feel like, the French resistance in Germany occupied France and continuing to, I'm not making any allegations or comparisons to the German party or any of those pieces, but just in terms of being in a bit of an occupation around presenting and being in a resistance, and at the same time doing work that's not really accepted elsewhere behind the closed doors, in terms of you need to be stealth sometimes around the work that you do.
100%. Thank you. And Lisa, what challenges has Saskatoon Community Clinic faced, and how have you been navigating those over the
Mhm.
years?
I don't know if you could tell, I was like frantically taking notes when Michelle was talking because I'm like, yes, that and that and that. So many parallels. I mean, the Saskatoon Community Clinic has really been quite fortunate that we have had stable funding directly from the Ministry of Health, so from the provincial government for decades, like really since our inception. And I know that that's something that not all community health centers have, and so that's great. But similar to Michelle, being under the primary healthcare services branch, it's a struggle sometimes to demonstrate the value that we bring as a community health center, because the metrics don't always align with how the metrics are coming from the primary health services branch. So where we struggle is that we're always trying to qualify or quantify the complexity of care that we provide, because our patients tend to be more medically complex, and we don't have a really good system in place to demonstrate that. So the Ministry of Health we shadow bill, and so they're able to pull the billing data, but it doesn't tell the story of what we do. So then we're trying to come up with our own measures of complexity. So putting in our electronic medical record, this person is unhoused, this person is experiencing, food insecurity, all these ways to just kind of demonstrate to our funder the work that we do. And so I think in my mind, that's kind of been one of the biggest challenges, is just being able to articulate the value that we bring to the community. On the converse side, the work that we do also sometimes puts us in that space of almost being a niche organization where, oh, you guys, like as Michelle said, the people that can't access care anywhere else tend to end up on our doorsteps, and we provide that opportunistic, low barrier, high tolerance care. At the same time, our mandate is primary healthcare should be accessible to everyone, and so we're always having those conversations as well with the health authority and the Ministry of Health around, we just don't want to always do the hard work. We want to be the model of care that's accessible for everyone in the community. And so that's an important conversation I think that we've continued to have as well. So I think from my perspective, it's being able to put your measurement systems in place that can articulate the value that you're bringing, and then having that strong and positive, productive relationship with your funder, and telling your story in a way that they're able to understand the value that we bring to community.
Thank you. On a slightly happier note than the challenges, what legacy do you hope both of your community health centers are leaving, have left? And what do you think the next, I'm going to average out 60 years, looks like for both of your community health centers? Lisa, if you want to go first.
I mean, if I was to sum it up succinctly, I hope that we're in the middle of our legacy. Like, what I want to see is that the model of care, the robust team-based care that we're providing actually becomes the way that care is delivered in our province. So right now we're kind of the exception, we're a little bit of the outlier, but I really feel that as a province we're moving more to embracing and adopting that. And so I hope that we're just in the middle of our legacy and that we can continue to kind of be on the forefront of what next. And I think again, this partnership that we're forming with the tribal council and really wanting to work differently and really embrace truth and reconciliation and demonstrate that in the neighborhoods that we provide care into, I think will also be transformative. And again, I think hopefully in a few years' time will be the way that care should be delivered in that population.
Awesome. And Michele, what about Centretown's legacy?
Yeah, I mean, I would carry on a very similar theme. And I guess, for me, when I think about the current arguments that we're having about ensuring that we have caring and compassionate care for immigrants and newcomers and refugees and individuals who are gender diverse and non-binary, and for those who are working with mental health or substance use crisis is to be treated with dignity and respect, and a lack of stigmatization in the services that they're operating, is that I hope that we continue to have that influence over the system as a whole, and not just that more people can receive their care in these kind of interdisciplinary teams that are also community based, but honestly, that are the services that are delivered within that caring and compassionate human rights, social justice framework, because there's something really important about recognizing that healthcare should be recognized as a human right, as the same way that housing is a human right and food security is a human right. Healthcare should be also as well, and that access to that full range of services is offered in a way that respects the dignity and individuality of people and their unique needs, regardless of the circumstances of life that they are in. Right now, I think we put so much pressure on people to conform to a standard of where they need to be in their lives in order to be deserving of care.
Mm-hmm.
And I think that that's one of the biggest pressure points that we have of really supporting people to live the fullest outcomes of whatever that looks like for them. And that also means being able to set aside what we think are the right outcomes for people. And right now, I think we've got a system of care that is designed around a particular set of outcomes and a particular way of delivering services or funding services that don't really meet those needs of individuals who are experiencing those barriers. So that's really what I hope our legacy is, and what we're trying to make sure that our voice of influence is in the system.
Michele, I'll ask you to any of the baby emerging community health centers, and there are so many, which is very exciting. What advice would you give them as they're starting out on this journey that Centretown has 57 years under its belt for?
Oh, I think it's so exciting to me when I talk to people who are just, starting in this process. For me, one is please, please, please fight so hard to have community development workers and health promoters, non-regulated health professionals as part of your interdisciplinary team and doing the work. They are so essential to making sure that you don't have just a medical model of service delivery, but is connected to the needs of the community. And secondly, really spend the time on what it means to work together as a team. So often people will pull in and the medical schools are spending more time training interdisciplinary teams, but a lot of our structures are still based on silo ways of practicing. And so working and spending some time in how that team is going to be, and thinking about how your whole organization, from your governance right to your volunteers and how you're doing support, that you are building in those equity principles now. How are you building in anti-racism, anti-oppression, anti-Black racism? How are you addressing in your structures your commitments to truth and reconciliation? How are you building queer positive organizations so that individuals who are from the 2S LGBTQ community are welcome right from the beginning, and thinking about that through every every step of your policy and education and engagement, that those are fundamental principles of how you're building and beginning, so that you're not having to do some of the repair and retract work that we are doing right now as older organizations, and having to unlearn and undo some of our systems before putting new things in place.
And Lisa, what would you say to any of these emerging CHCs?
Yeah, I mean, to add on to what Michele has said too, I think it's make sure from the beginning that you have the right structure, and that, as Michele said, you're carving out that time for your team to actually get to know each other and connect. Because one of the things that we found so valuable is at our one site, we have just right from the beginning, we've set out a time for a huddle. So there's a half hour, 30-minute huddle first thing in the morning, and all of our disciplines come together. And we kind of look at the day, see who's coming in, who needs to connect with who. So the community mental health nurse might make the connection that a physician needs to see that person, or outreach has, like, it's those conversations. But unless you've set out that time for and been really deliberate about these are the times for our teams to connect, you just get busy doing the work. And then pretty soon what happens is you're working in silos. So I think as difficult as it is to create those pauses throughout the day where you're not directly seeing patients, because everyone wants to be doing as much as possible all the time, it's really important from the outset that you kind of create those spaces. And then I would say yes to, Michele, what she said about like the policies and finding the right people and that ascribe to the same vision and philosophy of care that you want to have. And then I think my other advice would be ensure right from the beginning that you're able to track metrics in the right way to be able to tell the story that you need to tell to your funder, to your community, to your patients and members. And that's really key, as well as is having that kind of measurement system set up correctly right from the outset.
And Lisa, I'll ask you my favorite and my second to last question. What would increased federal, provincial, or municipal investment allow Saskatoon Community Clinic to do?
Oh man, I mean, what wouldn't allow us to? The sky is the limit. I mean, it would allow us to meet the demand for service. And I look at my staff that are coming in every day and just feeling like they're always having to fight against the system and all the barriers that are in place. It's difficult always to get more funding for the staff that we know we need and the model of care that we need to grow. So I think if we had increased funding, it would allow us to really embrace that CHC model, the community team-based care model, and really expand that, focus on health as the whole person, so that preventive promotion and the treatment of things. And I think also with increased funding, it would allow us to actually have physical space. That's the other challenge, that as a CHC, it's difficult to find capital dollars to expand your physical space. And so in some ways, we're also constrained just by the locations that we're working in and out of. So it's exciting to think about what we could do with more. I hope that day comes soon.
I'm fingers crossed for every CHC that I ask this question to, and all of them, because that's always the question where they're like, I would do so much with more investment.
Yeah.
And Michele, your turn. What would you do with more investment from anybody?
Yeah, I mean, I actually would love to see the model of interim federal health replaced with the federal government funding community health centers to provide primary health care in the same in the way that community health centers do, with salaried model, rather than the fee for service and all of the bureaucratic processes that have come with the interim federal health program. That's been one of my big advocacy pieces for a long time, that I would love to see that set up. I think it's the same thing as what Lisa said, and ditto about the capital challenges. We serve a fairly large area in the downtown core. I would love to also have sort of some different services so that it's also easier for people to get to us. But that's the piece for me that we continue to pick away at, and we've grown a fair bit as an organization. But my one dream would be the replacement of interim federal health program with a funding program like CHCs for that service delivery.
Awesome. I want to thank you both so much for your time. It's always a pleasure talking to both of you. And I thank you for your time, your wisdom, your experience, the amazing work you're doing at these community health centers, who I have been a pleasure getting to know over my now over 5 years with this company. So
Amazing.
thank you.
Amazing.
Now, if anyone else is curious, though, and they want to learn more about their community health centers, Lisa, I'll start with you. If anyone wants to know more about Saskatoon Community Clinic, what they should be going to see at your CHC in the summer, anything, where could they go to learn more?
Sure. So we have a website, saskatooncommunityclinic.ca, and we're also on Instagram, so you could follow us there to get some more information. And yeah, come to Saskatoon.
Come on down.
Right now is a perfect time, between now and October. Come to Saskatoon.
I was like, is it now? I'll wait for July.
The snow is almost gone, Hillary. I have high hopes that we're gonna be done.
I just wanted you to know it's 19 degrees here today in Toronto.
Okay, well, it is supposed to snow here a little bit tomorrow still, but
Michele. If anyone wants to know more about Centretown and what's going on in downtown Ottawa, and the amazing work you're doing over there, where should they check you out?
Centretown Community Health Center, CentretownCHC.org is our website. We do actually have lots of really interesting positions available for people who are looking to join the great world of work in a community health center. Ottawa is celebrating a big milestone birthday this year, so there's lots of events that are happening in the downtown Ottawa place, and giving a plug to my Centretown BIA folks who are doing all different kinds of really interesting things this summer. And of course, Canada Day. You got to come celebrate it in the nation's capital at least once in your lifetime. It is really something special.
Awesome. Perfect. Thank you both again so much. Again, amazing work. Congrats on being the oldest in your provinces.
Yeah.
And I will keep posted for the future birthdays. When Saskatoon turns 65, we'll do a write-up for sure. But thank you both for chatting with me as always. And I hope to run into both of you soon. Thank you for listening to Community Matters, a podcast from the Canadian Association of Community Health Centers. To learn more about our association and the important work of community health centers across Canada, go to www.cachc.ca.